Hi, everybody. Nice to be here. And as a medical doctor and a pain specialist, I see a lot of patients with anxiety disorder. And the thing I always do when I see these patients is I ask myself, what can they do for themselves? What can they do? How can they be active for themselves? And so on selection day, I was attracted from the first minute on by Mindable, because they really provide a solution that is for the patient. And when I met Mindable, I met a great team. And I think it's really fantastic what they achieved in the last 3 months. This team did a lot of things. They had, I think, 4 or even more great presentation and pitches. And they met a lot of clinical psychologists, psychotherapists, medical doctors, among them the, I think, well-known Mazda Adli, who's the head physician of Fliedner Clinic here in Berlin. And all these specialists were convinced that this solution is something really interesting for patients with anxiety disorder. And so I think what they achieved also is that they developed the NIA prototype from a concept 3 months ago, and now they already tested it on patients. And also these patients were convinced that this is a good solution. So just see on stage now, give an applause for Linda from the CEO of Mindable.
Well, thank you. Thank you, Philip, for this nice introduction. Today, I would like to tell you the story of Sam. 5 years ago, Sam was really active. He went to college, he had friends, and he loved traveling. Today, every time he steps into a train, he starts sweating, feels dizzy, and nauseous. This simple task feels almost impossible for him. Now, Sam is one of 790 million people around the world who suffer from anxiety. That's 10.4% of the population. The gold standard treatment of anxiety is called exposure therapy, where you repeatedly confront the situations you used to avoid. The goal is to reteach the body that these situations are not dangerous. And in a best-case scenario, you would always have a therapist next to you that helps you through this emotional journey. But with a ratio of 1 to 750, that's impossible, leading to the fact that only 8% receive treatment. We at Mindable developed a solution for this, and I just let her introduce herself.
Hi, my name is Nia. I am an empathic voice companion. My role is to help you confront your fears and so overcome anxiety. I'm here to make sure you feel encouraged and emotionally supported.
Nia will speak to Sam through his headphones. She will observe his anxiety level over time and anticipate when words are needed and when he can do it on his own. In our first version, Sam will manually rate his anxiety by using the volume buttons on his headphones. Later, we plan to use third-party devices with integrated EEG sensors to automatically sense the anxiety. And of course, we're not just throwing him into the situation right away. It's all part of a tailored treatment plan, where he first learns about anxiety, reflects about his own life, and prepares with small home exercises where he gets used to the anxiety symptoms. This treatment plan is based on treatment guidelines developed by the psychologist Thomas Lang. It is the guidebook therapists use to treat anxiety. And that guy is on our team as a scientific advisor. The anxiety market is huge. Treating and not treating anxiety costs us globally 810 billion euros per year. We will start in Germany, a $1 billion market for treatment. When we look at the competition, there's 3 sectors. Those that focus on skill and education, but don't support during exposure therapies. Then there's VR solutions that simulate exposure scenarios, but they're costly and adoption rates are low. And then there's digital solutions that connect you to a therapist, but they don't solve the gap of therapists. So now, how do we differentiate? With NIA, we have an emotional support system that has never been seen before. And we're completely aligned with clinical practice. So every time we talk to therapists, they immediately trust us. And compared to other solutions, our solution scales. We can treat many people at the same time and so overcome the bottleneck of limited resources. When we look at the patient journey, our sweet spot is right after diagnosis. Each therapist in Germany sees 22 patients per month for diagnosis and first counseling, but then has no option other than putting them on a 5-month waiting list. While therapists always look for ways to treat more people, patients are desperate for a solution in the meantime. With Mindable, we can create a win-win solution for both. We make money through the patients and later want to get reimbursed by the insurance companies. Anxiety is a pretty broad disorder with 5 different subtypes. In the beginning, we will focus on panic disorder and agoraphobia, the fear of public spaces and open spaces. Later, we'll expand to the other subtypes. We currently have a prototype of NIA and a click dummy of the designs. By April, we will have the product ready for CE certification and clinical study. And then we go to market in Germany. Then, after that, we expand to other subtypes and other markets. We're 2 founders in the team. My background is in psychology, and in my 2 Masters of Cognitive Science, I already worked on digital apps for OCD and PTSD. Then I pursued a career as user researcher and UX designer at IBM, where I met my amazing co-founder, who at that time worked on a virtual companion for data scientists. I seriously have never seen anyone code faster and cleaner than this person. Let's just say IBM wasn't exactly happy when he decided to leave. I just want to tell you with that we have expertise in all the topics we are touching with our product, and together we can cover the disciplines psychology, design, and development. Currently, we are looking for 500K for clinical validation, CE certification, and in order to expand our team. We're Mindable, and we bring psychotherapy into people's pockets. Thank you.